Okay, kia ora, good evening, everybody. I've just got changed, just getting ready to come on to the day of rest very shortly. But I needed to follow up on this Facebook live broadcast following our afternoon that we've had today. We've been, of course, preparing for our event tomorrow night in Christchurch. Very excited about that. And we had a great night last night again, packed houses again in Thames and in Coromandel. Fantastic teams. Kia ora Sam, kia ora Lisa, kia ora Trevor. But I need to be very direct about what I'm talking about right now. As you know, the New Zealand Public Party is essentially focused on providing solutions that will restore democracy, our economy and our sovereignty, protect our environment and, of course, our health sovereignty and our national sovereignty. That's what we stand for. But number one is democracy, and we are extremely concerned with the message that we have received from a lady today. I can't reveal her name. We're getting ready to go to the media with us tonight. But this afternoon, I had a very distressed phone call from a lady that has that returned from the Gold Coast, where there were only four COVID-19 cases. She returned from the Gold Coast 14 days ago. With her children, and one of them is an autistic boy of about 14 years of age. And when they got here, they got immediately sent to a quarantine facility at a hotel in Auckland, which they went straight to from the airport. Now, what happened was when they got there, of course, they were asked to test for COVID-19. Now, as we've talked about earlier this week, the COVID-19 test is very, very invasive. It's an examination as well as a medical procedure. And just to make sure you understand what's involved in it, it's a 6-inch swab, COVID-19 test swab, and they push it right up to the back of your nasal passage and into the back. Now, I've spoken to this lady about what she's been through, and she's actually been tested twice. I don't know why, and she doesn't know why, but they've tested her twice, and the second time, sorry guys, I just had a call come through. The second time that she had the test, it actually hurt her ear and the inner part of her ear, and she felt very sick after the second test, COVID-19 test. But what came of it was that her boy, who's 14 years old and severely autistic, did not want the test to be done on himself. Now, I don't blame him. It sounds very, very invasive, doesn't it? And so what she did was she provided the Ministry of Health all his health records, and I've got copies of those, and it proves that he's a very, very touch-sensitive kid, and he just basically anything like this will totally freak him out. So he completely resisted the idea of being tested for COVID-19. So they tested the entire whānau. 14 days later, they're meant to be released from quarantine tomorrow. Now, some serious issues are tied into the story, and I'm going to cover them off one by one. Number one is that they're meant to be released tomorrow, but they're not going to be because this young man, this young boy, has not been tested. And even though they've all tested negative, they're not going to release them. Now, when this lady was getting tested and they went to go and test this boy, and she said, no, that this boy's not being tested, the nurse said to her, well, you just stand by, there's going to be consequences. Fast forward to where we are today, those consequences is that they're not going to release them tomorrow. Now, what she needs to apply for is an exemption for her son based on the rationale that he can't take it and that they've all proven negative, okay? And they've all been together, and obviously if one's got it, they're most likely going to transmit it to each other. But it just proves that logic doesn't apply here. So anyway, what happened is they've been told that they need an exemption, but the issue is now they have been told that they're not going to be released tomorrow. She's got to apply for an exemption, but she doesn't know who to turn to. Now she's trying to get a hold of people at the Ministry of Health. They can't do that. The people in the reception downstairs in the Ministry of Health office will only allow them to voice their concerns to her, and she will send an email. So there's no direct communication like going between her and the Ministry of Health. But there's another part in this, and this is what we've been saying all along, is that the man in charge of this is a flight lieutenant from the number 14 squadron in the Royal New Zealand Air Force. Let me say that again. The man coordinating this is a flight lieutenant from the Royal New Zealand Air Force. He's from the number 14 Squadron, and he's not a medical officer. He's a flight instructor. Now, this man is trying to, and he sounds like a very nice young man, is trying to coordinate between himself and the military structure and the civilian Ministry of Health organisation. And there's this huge breakdown. He doesn't know what's going on. He's trying to find out how he can help this lady. But as he said, I've got all the emails, correspondence. He's saying that he can't do any more than what he's told to do. He can't grant an exemption. That has to come from the Ministry of Health to him, and then he can release them based on that the son has received an exemption from the testing procedure. Additional to this, nobody has sat this whānau down and explained to them how, under the COVID-19 health response bill, how they are being detained from a legal point of view. So they haven't had their rights read to them, because tomorrow, if they want to leave and if they are prevented, they are essentially going to be arrested. And it's at that point when you arrest anyone, as all policemen know, and all former policemen, you have to give them the caution. You have to read them their rights right then and there, right? And that's New Zealand Bill of Rights stuff, that's human rights stuff. You've got to read somebody their rights. But nobody is explaining to this whānau their legal position in this, and that's deeply concerning. Deeply concerning, family, and this is what we've been saying all the way along, that this is a major, major issue of rights and freedoms destruction here, and we're now seeing it. This is the first whānau that have reached out to me and NZPP to fight for them and stand for them. I've just got off the phone to the lady just now. She's calmed down a wee bit, but they're all very nervous and very concerned about what tomorrow is going to bring for them. And the other thing is that she was saying that, you know, some people that she knows of in other facilities are leaving the facilities to get alcohol and coming back, and they're not being detained the same way. So this is very, very strange stuff going on, and but this whānau is feeling the brunt of this crazy situation right now. So what NZPP we are doing, we are constructing a press release with her statement in it. We're going to release it to the media tonight, to News and Media Hub, and our sole objective is to shed light on this conversation and on this terrible, terrible situation, because more than anything, this lady's got nowhere to go. She can't find anyone at Ministry of Health to talk to. The flight lieutenant that's in charge of the quarantine at this particular hotel, he's not able to help her, and he doesn't know what's going on either. So there's something very, very, very strange going on here, and I wanted to alert you about this, because that's our function here. Now, NZPP, we are now focusing on solutions. We know that there's problems there, and we're going to talk about them, but now we're going to focus on the solutions and let New Zealand know that we are not a one-trick pony party. We've got it all covered, and it's economy, environment, everything, and this is where we're going now. So, whānau, I just want to wish you a happy rest, and just keep this lady and her whānau in your prayers, and pray that they'll get released tomorrow. But they have been told by a nurse that, and by the flight lieutenant himself, that they cannot leave until the boy is either tested, which would mean another 14 days lockdown, or they receive an exemption and they can't leave until either of those things occur. And in our view, that is ludicrous when all of the whānau have tested negative and they fulfilled their consent and their obligations in those other areas. So thank you, everyone. Thank you for your time. We'll see you tomorrow night in Christchurch. God bless all. Be safe, and spread the message always that New Zealand Public Party is your voice, your power, your party. Good night and kia ora. God bless.